We're live on Monday. And can I be with two of the coolest people around right now? I'm super excited about that. With my partner, Jeremiah Sarket here from the Ovadia Art Health team. And we are thrilled to have Dr. Jason Hahn with us today from Pasadena. And Jason, we're going to let you tell us all the good stuff, fantastic that you're doing. But before we kick it off, we have to put up here our medical disclaimer that anything we talk about here today is intended solely for educational, inspirational, motivational purposes. This is not individual medical advice. If you're looking to work with Dr. Ovadia and the team, reach out at team@ifixhearts.com. And that's all the housekeeping stuff. Jason, welcome.
Thank you. Thank you for having me, Krishna and Jeremiah. It's great to see you guys. A little bit about me. My name is Dr. Jason Hahn. I am a board certified sports clinical specialist in physical therapy. I co-own a facility here in Pasadena, California with my wife. My wife's a chiropractor. Our facility is called HealthFit Physical Therapy and Chiropractic. We provide physical therapy, chiropractic, and wellness services. One of our biggest parts of our wellness program is our hyperbaric oxygen therapy chambers. So a little bit about me and past experiences. I spent a lot of time in professional sports, Pittsburgh Steelers, Cirque du Soleil. Most recently, I was with the Los Angeles Football Club as their head of rehab. And after 6 seasons, I left to focus on the practice and my family, wife Kelly, 2 amazing kids. That's a little bit about me.
Well, that was definitely the Cliff Notes version. You have done so much, and we would need a couple hours to go full extent on there. But as we mentioned before we sort of kicked it off, that we're focused here on employee wellness. And every time I look at some of the statistics, I still see musculoskeletal injuries, the biggest cost driver in companies. It doesn't seem to want to be budging from there. Can you give us, Jason, some of your insights on not only your teams that you work with on those, but in your clinical practice of kind of what you're seeing? We're always looking to help people say, well, okay, that's the problem. What can we do? Just your incredible insight on that issue.
Yeah, I think employee wellness is huge. But it's not isolated just to my employees. I'm lucky enough that we have a health and wellness business, but if you look at low back pain, top 3 highest causes of disability in addition to cancer and heart health, I believe, in the States. So it's quite crazy when you look at the numbers and then we see how many people are affected. When we look at my team, for example, or even professional sports teams, the idea is to keep people as healthy as possible. So number 1, they can be around, and number 2, they can do an amazing job. And it's not just isolated to sports. It's in every business. Employees are the lifeline of each business, but it's also one of the biggest hardships, right? If you have to deal with someone that may be having an abnormal health condition or gets hurt at work, what does that do? That decreases your labor efficiency ratio if you want to get down to a number standpoint. So I think it goes many levels, and it's important and it's often overlooked.
Absolutely. I see Jeremiah is waiting to jump in there, so I'll let you go.
Nice, Krista, and welcome, Jason. You and I go way back, my friend. It's great to have you here. Small world. And team, Jason and I know each other from another amazing community, Paul Golf and his community, so another wellness community. But I want to go back to where we first connected, Jay, as athletes, really. So having been an athlete yourself, having worked with professional athletes, what are some key takeaways on the metabolic side, even the diet side, that you can share with us? And just to give you a little bit more, I think, Kristen, we're at episode 15.
Something
So
like that.
we're trying to keep this going every Monday, Jay, teaching, bringing value, and your expertise here is going to be huge.
No, now I'm reflecting. So my past athletic experience I was on the U.S. national team for Taekwondo for 7 years. I was third place at the 2000 Olympic trials, 2004. Unfortunately, my division didn't get to go. I was a resident athlete at the Olympic Training Center, and I'm currently 45. So about 20 years ago, that was when I was in that space. And looking back, I was in a sport where cutting weight was a thing. I was cutting anywhere between 15 to 22 pounds for a competition. And yeah, you talk about metabolic health, right? It's like I was doing it the old school way. I was going in saunas. I was dehydrating myself. I was literally taking a credit card and then scraping my skin, because that's what the wrestlers did. It opens up your pores.
Yeah.
You would do certain things, like you would put Abilene, which is a makeup remover, on your body to close your pores to keep the heat in. Or we would bring a bike in. That's my version of metabolic health back in the day. But what I've learned working in professional sports, like fast forward now, and how much that is part of human performance it's amazing, but we have a lot of ways to go. So anything as simple as hydration, what supplements are you taking, the kind of food that we're actually serving in the cafeteria. We at LAFC in particular, we have Connor Spencer, who is our team nutritionist, and he taught me a lot about what goes into these things. And from a meal prep before a game to a loading phase of training, to the recovery methods they use post-match, post-training, to something like even concussions. How are we fueling concussions? Because you have a metabolic insufficiency in the brain. Then at the end of the day, it's important that, and we're not talking enough about it. And it's a very specialized skill and education. Like
Nice.
Dr. Ovadia, and what he brings to the table from a cardiovascular expert, what my buddy Connor brings from a nutritional expert. So there's a lot of layers to it that at least is coming to the forefront that I wish I would have had access to back then. And I think that's what drives me is I have 3 world silver medals, but that kills me. That burns me from the inside, because what if I could have hydrated a little bit differently? And then you're thinking about your body, and it's like, okay, yeah, maybe I would have felt better, but I needed that hydration from my brain so I could think clearer. And that's the kind of perspective I take to not only my athletes, but every client or every employee here at HealthFit, where we're always trying to push the envelope. It's not about just being okay. It's about being great. So if we continue to push that envelope, then we can do better for our community of clients and patients. And then it curtails you from there to their families.
I know Chris is all about the best version of you possible. Yeah, well done.
This is what we call performance mindset. That it's not striving to be okay or just, I dare I say the word mediocre. We want to be vibrant beings and perform well. And a few things that pop out to me is so akin to my career at 30 plus years as a professional dancer. Oh my God, we did everything to cut weight or to stay thin, right? Wrapping plastic around our bodies and then putting our dance warm-ups on so we could sweat a little bit more. We did all the crazy stuff for sure. But we hope to instill is what you're doing is give everyone the chance to be able to be more metabolically fit without doing the crazy stuff.
Right.
But just doing some good, consistent, whether that, I love your idea that you have different trainings for one aspect. You might have a different warm up if you're doing different things. What about your post recovery? What about your nutrition? And that's where we see our role these days in employee wellness is trying to bring performance to the workplace.
Absolutely. It's I'm just thinking about like even past patients, or like let's say they weren't healing as well, or even athletes. Okay, they're not healing as well, and then we just talk about their diet. And for whatever reason, they've cut the amount of food that they're eating is because I'm not working out as much, I'm not burning as much. But you need to eat in order to fill your body to heal. It's a very simple concept, but it doesn't make sense for some people, I would say. Um, yeah, it's like something's just as simple as that. And even when cutting weight, you're going into more a calorie deficit, but what you actually need to do is eat more. So you would have the energy, and then you would actually burn your fat stores instead of your glucose, right? It's just like when you're in it, it's tough because you're so emotional. But that's why hopefully with professionals like myself, I guess, and you two, is to impart that knowledge in a way that hopefully makes sense for them so they can do what's best for their body.
Yeah, 100. It's that leadership component, Krista, that you hit, like we've talked on the last couple of episodes and the white paper just recently. But Jason, I think that's where you and I connected. Like second was like the leadership piece and the way that you work with your team and develop people. When we look at developing people and bringing this maybe into like the workplace, maybe a new leader or somebody that's tasked with finding a wellness program or creating some wellness education, how would they go about doing it? What would be something that you would do, or something that you have done to get this moving?
I would say the first part is just realizing that it's important. Like I said earlier, it's business 101. You have to invest money to make money, right? And then me being of Asian descent, I am cheap. I do not want to spend money. But
you need to talk to my Dutch husband.
But as time goes on, right, you understand that I need to invest to make more. And so number one, understanding that the longevity and your health of your employees is of the utmost importance. So what I would say is, again, I'm fortunate to be in a health and wellness setting where we're always on our feet. But I think we've all been in situations where we're stuck at a desk. That's kind of what I'm doing more nowadays. But the one I have right now is a standing desk. So everything as simple as, is that an option? If it's not, then it's your ergonomic setup. How is it set up at your desk so we can decrease the incidences of neck pain, back pain, hip flexor tightness, however you want to call it. I think that's number one. I think number two is having a culture of health and wellness. Part of our system here is we're in health and wellness, so we want to epitomize health and wellness, because if we're asking a client to do something and we're not doing it ourselves, I'm being a hypocrite. So like from a cultural standpoint, to epitomize what health and wellness and movement means. And just to keep moving, like I said, keep moving. Some of our team during lunch, they're working out. We're lucky enough to have like a treadmill and weights and stuff like that. That is just the culture of HealthFit, where we are always trying to stay on the forefront of wellness, because that's just us. But the result of that is less injuries. You're not gaining weight. It's emotional health. All these types of things to keep yourself moving throughout the day.
And it ultimately, from that leadership piece that Jeremiah and I talk about every week is leading by example. In historically and I've been around for some more decades than you two have been. Historically, worksite wellness has been a lot of good ideas on paper, and many of the leaders did not participate. And we want to really change that paradigm because it's very influential in what your word number 2, building a culture. And that often what we see in our business, sadly though, is many come when they have, obviously we work with a heart surgeon with heart problems themselves. So they've had a wake-up call and now they want to make a change. We hope we could grab some before they need that wake-up call.
Right. And then it's true. It's when we're working with clients that want to get healthier, they want to get more active. And the first thing you need to know is like, what is the current activity level?
Yeah.
Right? Do we have a way to measure that? And then it doesn't have to be perfect. It doesn't have to be 10,000 steps a day because that's like the gold standard from a Fitbit or whatever it is. But I think it's okay. Let's just do a little bit more. And is that manageable? And if you can do that little bit more and you are incorporating proper metabolic health with it, in an ideal situation, you start to feel better. And that is your positive feedback loop. And along those lines, right? I'll say, okay, what is the first goal? Let's say you're in the house all day. You probably have less than 500 steps, depending on the size of your house and how far you go from the kitchen. Can we get 600 steps, 700 steps, and just consistency? And let that be the proof in the pudding to show them that it number one, it is doable. And then if you're incorporating it with metabolic health, you are feeling better. And with that, there's that consistent conversation, that's consistent check-ins and tracking your progress to get them to buy in a little bit more. And that's the hard part with anyone to try to make progress. It's like, where do I start? But if you have that positive feedback loop and you're able to cheer them on during the process and know that it is for a greater good, and then yes, the greater good is your own health, but it's the effect of your health on everyone around you. It's not just you. If you have a significant other, if you have kids or grandchildren, it's to have that perspective that it's much bigger than you when you think about it, and then you are that important. It's you don't look at yourself as insignificant. You are very significant in this greater scheme of things. In order to be able to get to where we want you to be or where you want to be, it does start with you, though.
Yeah, that's awesome.
Let's ride the wave.
And that really hits home. One of our first things that we do when we start our metabolic health programs on site is, why do you want to be healthy? Because that sets the tone, that sets the picture of this. It's bigger than me. And we hope to continue to keep reminding people about that. We do have a couple questions in I want to see here. Let's see. Thanks for these discussions. Many workplace injuries seem inevitable. From your experience, how much of the risk is actually preventable, and what role should leadership play in?
Great question.
Yeah, big question.
How do I answer this? well, I would say the first one is from my training as a physical therapist. I am very movement based. So like if I was going to break it down into its components, if I watched someone squat or bend or balance, based on what I see, I can see the impairments, whether you're lacking mobility, whether you're lacking flexibility, whether you're lacking even coordination. And there have been enough studies to show that if you are lacking some of these components, you have a higher risk of injury. So let's say, for instance, in isolation, let's say I watch someone do a squat, and then when they squat down, they don't go as low on one side. So that might, let's say it's a mobility issue in their ankle or their hip. If I resolve that, the squat looks more even. So on the other side, let's say you don't correct it, and then that one side goes down a little bit too far. If you're in a work environment where you have to get down and pick up objects repetitively, you are causing micro trauma, repetitive micro trauma over and over and over and over again on whatever the structure is. So that would, in essence, increase the risk of something happening, because most of the time these injuries are an accumulation of micro trauma, chronic issues. So everyone thinks that, oh, when I bent down to pick up the pen, my back went out. They think it was that event. It was not. It was the years and years of bad movement patterns or lack of mobility or sitting in the desk all day where you're not getting up and stretching your hip flexors is what caused it. So I say that in my world, whether it's in a workplace or athletics, I truly feel that we can decrease the risk of injuries. Whether we eliminate them, obviously not, things happen. Mm-hmm. But there is something to be said that if you put in the work and well, number one, if you can identify where the holes are, and number two, if you can actually address them accordingly, your risk will go down.
That was a great answer about how chronic injuries are not just that one time bending over and your back goes out. Would you think, this is just a pure off the cuff, that leaders or leadership team should be undergoing some type of movement assessment?
Absolutely. And things have evolved over the years. One of the biggest ones was like the functional movement screen, and they have the selective functional movement screen, stuff like that. I think, like me personally, I use a kind of a blend of everything, kind of what works for me. But even if something as simple as, okay, everyone bend down and touch your toes. From one is, okay, can you touch your toes? Are your hamstrings flexible enough? But with a watchful eye, how are you going down to touch your toes? Do you have a low back strategy where you're actually going through your low back, or you're going through your hips, or you're going through both? That's a trained eye looking at something as simple as going down to touch your toes. So you look at something as innocuous as going down to tie your shoes and you hurt your back. More often than not, you're doing a back strategy versus a hip strategy. So I think it's just enlightening people that these are little nuances that most people don't know about. And if you can educate them accordingly and you get them to be a little bit more active. And so what does this even mean? Back strategy versus hip strategy. If you can actually bend through your hips, in the fitness world, that is a deadlift. That is a hip hinge. That's how you should be going down to pick something up. That's part of it. And number two, that's how you hip hinge when you're brushing your teeth.
Right.
They're all there. So if you can educate and then you can illustrate it to them, hopefully they buy in, and then they're going to be around for a lot longer with less pain.
That's awesome. Solid.
At the end of the day, it's about education. And I think it's one of ours. We start our weekly meetings, education and empower. And, there, from our perspective, there's a lot of lack of knowledge about what metabolic health is. And I know, Jeremiah, I just set myself up because every week I've promised to say the 5 markers: waist circumference, blood pressure, blood glucose, triglycerides, and HDL. And even though we've been talking about movement, movement plays in is a high contributor to either good metabolic health or poor metabolic health on many fronts, not just from, moving our arms and legs, but, moving our blood glucose around. Any sort of, we also too have tended to have a lot of individuals. We've been talking about companies and leaders, but someone who's just wanting to basically keep mobile. What are your top tips?
I think going back to what I said earlier is just do a little bit more than what you're currently doing. Especially if you're quite sedentary, but go in baby steps. I think on top of that is get assessed, go see a professional that is skilled in at least looking at movement. Because even if we go back to the COVID days, what did people do? They were stuck at home. I'm gonna go run 5 miles, and then they end up getting hurt because they didn't grade it from 1 mile to 2 miles up to 5. They just went all out. And then what happens from there? They get hurt. And then I've seen, I would say the majority of cases, they just stop because no one's guiding them through the process. They're thinking like, I'm trying to do something great. Everyone says running is great. I'm going to run 5 miles and now I'm hurt. There is definitely an in-between, but their minds are not, they don't think that way. That's why you have to go to a professional first in order to assess the situation. So I would say assess the situation to see what little things you can be fixing, and then marry that with whatever your goals are. If you have metabolic life goals, if I want to increase my activity, what does that even mean? Then I can help choose what that modality is. Maybe running's not the one for you right now. Maybe it's just walking, maybe getting you a stationary bike. That might be the right entry point for you so you can get to, your destination. But to talk to someone that is able to look at the entire situation, look at your goals, look at your own body and see what restrictions you may have, and then figuring out a plan. And then once you have the plan, you have me or one of my team is in order to keep you accountable to that plan, because we're all going to fall off here and there. And it's just like you said, revisiting what that why is. Why are you doing this? And these decisions are rarely all or nothing. They're always somewhere in between. And it's good to have a person, organization that is in line with you to help you reach each single part. And then if you have that consistency, you will hit your goals ideally.
Wow. I'd say for anyone listening, you just got a whole lot of great information in a short amount of time. And, we always say as well that, there is no perfection in this. Once upon a time when I was a professional dancer, I thought there was a perfection, or at least that kept me going and competing. But there will be ups and downs, but you need a team. We accept there's coaches in business, that there's coaches in sports, that there's coaches in every aspect. And now we have to accept that we need coaches with our health.
Well, absolutely. Jason and I, we learned this last year. It is just a bit better. It's 1% better every day. When we do that and we take those baby steps, now we're taking huge bounds at the end of it. And this is a good call out, Krista, for our amazing content that we have. We can access that, you guys, right here on the website. Download it, get into it, dig in and ask questions on the Monday episodes. And then you can also join us in a strategy session and get those questions answered.
We have 5 white papers out on sedentary behavior in the workplace, addiction in the workplace, mindset matters. We have one on diabetes and looking at nutrition on that. And we're going to have one coming out soon on musculoskeletal health. So We were totally honored, Jason, to have you here today. And I can't believe you already knew Jeremiah and I. The world is just way too small.
It's a good
Again,
world. It's a good world.
to reach Jason, you can reach him at his amazing company. And I say that I was a client with two very different injuries. I had a shoulder injury and a hip injury, and I'm living proof they're successful at HealthFit INC in Pasadena, California. And we hope to have you on again, Jason.
Thank you for having me. It's been an honor, and it's good to share.
Always great to be with you, Jason.
Keep doing what you're doing.
Lead the way, brother.
Appreciate you. Thank you.
Thank you, guys. We'll see you next week.